And I'd like to ask Rachel Boothman to come on up.
Good morning, everybody, and thank you for the opportunity to share our work with you today. I'm part of the team at the MND Association for England, Wales and Northern Ireland, which produces education and information resources for people living with MND, their families and carers, and also for health and social care professionals. What I'm going to talk to you about now is by no means just the work of our team. It's a collaboration of our colleagues across the association and also of health and social care professionals and families affected by motor neurone disease, ALS. So those of you who attended the APF or the symposium in Dublin last year may have heard that in 2016, the National Institute for Care Excellence, which is also known as NICE, published the NICE Guideline on MND. And this provides comprehensive recommendations on the assessment and management of the disease. It aims to improve care from the time of diagnosis, and it covers information and support, organisation of care, managing symptoms, and preparing for end of life. The guideline applies in England, Wales, and has been endorsed in Northern Ireland, and the association is pushing for full implementation there. So I think you can see from the quote on the slide here that the NICE guideline is really important to people with MND ALS. But it's also quite a dry topic, so I thought I'd use a few emojis to help me tell the story. So I think it's fair to say that this is how we felt at the association when we learned that there was going to be a guideline for MND. The association had campaigned for more than 4 years, and we believe that MND is one of the rarest conditions with a dedicated guideline. We're delighted that professionals now have evidence-based recommendations on which to base their practice, and it enables people with MND and their families to understand what they should expect from their care also. So once the initial delight had faded a little, we realised that we had to get down to business. There was a big task ahead to ensure that the guideline didn't just sit on the shelf, gathering dust, and was actually used to ensure high quality care and support for people living with MND ALS. Our members were also keen to understand what we plan to do to promote the guideline, and there was lots of discussion on social media and also on our online forum. So what did we do? Well, we have a NICE Guideline steering group, which is made up of several colleagues across the association, and this has developed a very comprehensive work plan, and I'll tell you about some of the resources that have come about as a result of that shortly. This feeds into a programme board, which includes our chief executive and a couple of directors and 2 programme leads. And then we also have input from a clinical advisory board, which is a group of clinicians who are experts in the field. And they support us and advise us and give us input also. And many of them were actually on the MND development, NICE Guideline development group. So what were we trying to achieve? So in essence, the guideline is a complex document which is written using professional jargon, and we wanted to find a way to translate it so that it could be easily understood and used to improve services. So this was our goal, to develop a range of resources to help families with MND and professionals to understand and use the guideline. And I think it's important to say as well, it didn't stop there. We also had engagement events, and we met with a range of stakeholders to really try and promote the guideline. And this is ongoing, it doesn't stop. So what are the resources? So this is just a snapshot, and I'm going to talk about each one in a bit more detail on the slides that follow. But first up is the information sheet, and then we have a pocket guide, an animated film, a presentation, and an audit tool. And those on the left-hand side of the screen are really aimed at people living with MND and their families and carers, and those on the other side are aimed at health professionals. So the information sheet. So this was the first resource that we produced, and this was developed by our care information developer who sits within our team. And it's one of a number of information sheets that we produce on a range of MND-related topics. And as you can see there, the number is 1A, so it comes at the top of our list, which really highlights its importance. The numbers of downloads we've had since launch is 967, so that's the number of downloads from our website, and 515 paper copies have been requested. Moving on to the pocket guide. So this is a small booklet. You can get an idea of the size. I'm holding it up here, so it's big enough to fit into a wallet or a purse or a bag, and people can take it along to clinics with them. So we held a workshop at our AGM, and people with MND were telling us that we needed a more practical tool to help use the NICE guideline. And there was a consensus among people with MND that this is what was needed. So we took the task on, and as our information at the association is all accredited by the information standard through NHS England, we set about making sure that we tested it with our audience. And we have a user review group who looks at all our information and checks it for tone and how easy it is to understand. And we got some feedback which was really useful. The initial concept of the booklet was actually a concertina-style leaflet which folded in and out. And people with MND ALS were telling us that it was too difficult to manipulate and handle because of dexterity problems. So we changed it and made it into a small booklet. So you can see there from the downloads it's a particularly popular piece. And we've also had quite a lot of international interest. It's been adapted in Iceland, and there's also interest, I think, from Australia to inform their campaigning work. So next up is our animated film, and this was based on the pocket-sized leaflet, which I've just explained. So this was produced by our colleagues in the communications team, and this enables people with MND to access the information in a different format. And it also ensures that the resource doesn't date as quickly because it's using animation. And we're going to take a look at the animation now.
What you should expect from your care. The NICE guideline on MND can help you discuss your care with professionals. It recommends suitable treatments and the support you should expect to receive. Everyone with MND is different. It's unlikely you'll need all the support shown in the guideline all at the same time. Some you might not need at all. At diagnosis, you should be offered a follow-up appointment to receive further information and support. Have you been given a contact for a specialist MND or neurological service? Regular coordinated assessments will help manage your symptoms. Were you asked about the thoughts and feelings you, your carers and family have about MND? You should be offered information about how to access emotional support and respite care. Have you been asked about any changes to your thinking or behavior that might need an assessment? Has a healthcare professional recommended a suitable exercise program? Have you been offered medication to help with any pains or cramps? Have you been assessed for daily living needs, such as shopping or personal care? Do your equipment and home adaptations meet your current and potential future needs? Have you been referred to a wheelchair service if needed? Has a speech and language therapist assessed and reviewed your communication needs? Do your communication aids work well with other assistive equipment you may have? Is your weight being monitored? Have you been assessed for any swallowing, eating or drinking problems? Has anyone discussed alternative ways to receive nutrition, such as tube feeding? Do you have any problems with your saliva? Have you been offered support or treatment? Have you been assessed for any breathing difficulties or heard about non-invasive ventilation, NIV, or other support options that can help? Has a healthcare professional shown you ways to improve the strength of your cough or discussed the use of a machine or techniques to help you cough? Have you been offered an opportunity to discuss your future care, plans and concerns about end of life, if wished? Have you had contact with specialist palliative care services? Hospices can improve quality of life for you and your family and are not just for end of life. If you don't receive the care or treatment you need, discuss this first with the relevant health or social care professional or provider. The next step is to make a formal complaint. For more information, visit www.mndassociation.org/mycare. If you need further help, support, or would like to order any of our publications, please contact our helpline, MND Connect, 0808 802 6262. MND Connect at mndassociation.org.
Okay, so this video is available on our website and on YouTube as well. So moving on to the resources that we've produced for professionals. So we have a number of regional staff that work across England, Wales and Northern Ireland, and part of their role is to facilitate education for health professionals. So we decided to put together a basic, simple presentation, PowerPoint presentation, which covers the main recommendations in the guideline. It's really meant as an introduction to the guideline, and it's signposted to other information. And the final tool is called Transforming MND Care, and this is an audit tool. And this has been produced to enable service providers to really see how they measure up against the NICE guideline. And you can see there on the screen the sort of proposed benefits and outcomes of the audit. So this was quite a big project, which was led by one of our regional delivery managers. And there was a person with MND and a carer actually on the development group. The audit itself comes in two parts. So there's an Excel-based clinical audit, which is completed by referring to patient notes. And there's also a patient experience survey. And this helps to triangulate the data by giving a user's perspective. And it was actually piloted by somebody with motor neurone disease, ALS. So once completed, the information is all sent back to the MND Association, and it generates a report including graphs and some points for consideration for the service, and it's returned to them. This was piloted in various sites across the area that the association covers, using different models of care, and it's currently undergoing a review, and we're seeking endorsement from NICE, and we're looking to launch the new version in January. It's also been endorsed by several Royal Colleges and professional bodies in the UK, so for example the Royal College of Nursing and the Royal College of Occupational Therapists. So you can see from this slide the reach of the audit tool. So around 138 requests have been received from NHS organisations in England, Wales and Northern Ireland, and we've also had quite a bit of international interest. So in summary, information which helps people to understand long and complex guidelines can prompt discussion and help to improve outcomes, care outcomes. It's really important to listen to our audience and to test and to pilot tools to make sure they do what we hope they will do. And we can't stop promoting. You know, this is an ongoing process. There'll always be new people coming through with MND, being newly diagnosed, and new healthcare professionals qualifying, and we need to keep this on the agenda. One last emoji. I think the guideline has been used successfully. We've heard of several cases now where it's been used to actually influence commissioners to fund posts, whereas they weren't funding them before. And we've also heard where a GP, a general practitioner, has been challenged to prescribe some medication because it's part of the NICE guideline. So that's fantastic news. And one final word, which I'll leave to a person who's actually living with Kennedy's disease, but the association also supports people with Kennedy's disease. Talking about the pocket guide, which I spoke about earlier, they said, "What a great idea. How often do we attend appointments and then come away without asking all the questions we were meant to?" Thank you for listening.
This presentation is now open for questions.
Yep. My name's Christy. I'm from Leahy Hospital right around this area. I'm just wondering, we sometimes have had some patients who want a lot of information initially, and they, you know, like you said, sometimes it's good they get home and they can look at it, but we've also had the opposite, where we've handed out some information or given them resources, and they've said it was just way too overwhelming in the beginning. I'm just wondering how you figure out how to balance that.
Yeah, so I mean, this booklet is sent out with our guides, but really it's down to the person whether or not they choose to read it. And really the people who are receiving the guides will have been seen by somebody usually in a clinic, and they will have been referred to us for information, or they'll have been on our website and looked at it and, you know, downloaded it themselves. So really it's down to the choice of the person, but also, if a clinician's referred them to us, then that's how we play it. We don't sort of force it on people by any means.
Any other questions? So I know the NICE guidelines are specific to your country, but are they available? Anyone from any other country can download them, and have you ever heard of another country also using them to try and change their
They are
Yeah.
available to download from any country. So I think we've had interest from Iceland. They've been in touch with us and asked if they can adapt the tool, in particular this tool, the Little Pocket Guide. So yes, it is available if people want to adapt it.
All right.
Okay.
Thank you very much.
Thank you.